When I work through blah, 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 I will then be ready to do intensive trauma therapy. I think there's also a fear that it's not going to feel good. There's no one definition for trauma. Trauma can really be anything that a person finds distressing for a prolonged period of time, that they're finding that it's impacting their daily functioning and they're not able to kind of move through it, then it's valid trauma to work on it. Whenever we get the sense that somebody might be experiencing some type of trauma or PTSD, oftentimes we'll see people kind of withdraw from the activities that they once kind of enjoyed or like to be a part of. So we see a lot more isolation, avoidance of a trigger. So whether that is like avoiding a place where something happened to them, avoiding a person who might be activating to them, avoiding like certain smells or certain environments. We also see in sometimes people who are a little bit more hypervigilant. So maybe somebody's feeling a little more anxious or on edge or feeling a little bit paranoid, but maybe not necessarily being able to explain exactly why. Sometimes people will express to us that they're having more nightmares or flashbacks. We also see kind of an uptick in people's maladaptive coping skills. So maybe people are turning to substances or self-harm or disordered eating or something like that. So, and that kind of goes along with the avoidance piece too. I think oftentimes I hear that, when I work through blah, 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 I will then be ready to do intensive trauma therapy. And I think there's also a fear that it's not going to feel good and somebody might not feel better. And I like to manage expectations around that, where at first, when you start doing trauma therapy, it actually might feel a little bit worse at first. Your symptoms might actually spike up when you start doing trauma therapy. Your anxiety might get a little worse. You might have a little more nightmares or flashbacks. And that's all part of the normal process of it. It's your brain really trying to work through the trauma and process what was going on. And so we just want to make sure that somebody has enough kind of coping skills in their tool belt to be able to cope effectively if and when they start to have flashbacks, or if or when they start to get activated. Because it's not really a matter of whether or not that's going to happen. It's really going to be whether somebody has the coping skills or not. So if somebody's in a place where they're engaging in maladaptive coping skills and really have no ability yet to really self-soothe or turn to more effective coping skills, the first step would actually be developing those skills before doing a deep dive into the trauma work. But once somebody kind of has established those coping skills, then I would say that somebody is ready enough to do trauma therapy. If you're starting to see your loved one kind of withdrawing from the things that they like to do, or they're feeling more anxious, they're more panicky, a little more hypervigilant, it's kind of a good sign that they're going through something. It could be trauma. If they're starting to avoid a place that they like to go a lot, if they're starting to avoid certain environments, then that could be a good sign that they're struggling with trauma. Trauma can really be anything. Oftentimes I think people kind of think of trauma as like the big T trauma. So a car accident or like a death in the family or some natural disaster or something like that. But trauma is pretty subjective, and it could be something like a breakup or ongoing conflict with a friend or something like that. So trauma is really relative to that person. The other misconception that I think comes up is that you have to be perfectly well adjusted to do trauma work. I think that, again, like, you just have to be ready enough. You have to have this coping skills, and then you are ready to kind of do trauma work. Sobriety is important for intensive trauma treatment because one of the big maladaptive coping skills for trauma or PTSD is avoidance. And oftentimes substance use is a way to kind of like avoid difficult feelings or avoid situations or disconnect. And really the purpose of trauma work is to actually reconnect to your feeling. And so we want to avoid anything that's going to alter our ability to really reconnect with ourselves or our emotions. You can really start anywhere. I think trauma groups and individual trauma therapy can be really intimidating to a lot of people. And by starting anywhere, I mean it could just be finding a community where you feel welcome and accepted. A lot of research shows that you can target PTSD and trauma symptoms through things like community and friendship. And so for somebody who's really scared of trauma treatment, the way that we think about it, we can just start getting them integrated into some type of community or more social setting as a good entry point.